ओडिशार निजस्व हॉस्पिटल कलिंग हॉस्पिटल। समस्त नमस्कार। ओडिशार प्रथम हेल्थ चैनल प्रिकॉशन फॉर हेल्थ को स्वागत करुछि ऋतुपर्णा। दर्शक बंधु एटा तो कहवा दरकार नहीं कि आम ओडिशा आज हेल्थ सेक्टर रे नंबर 1 अछि बोली। सतरे गोटे समय थिला जेतेबेले स्वास्थ्य संबंधी किछि भी जिंस इवन इफ ट्रीटमेंट कथा हो सर्जरी कथा हो आमे ओडिशार बाहर को जाउथिले। ओडिशावासी सबुबले भाबुथिले काले बोध हुए आम ओडिशा रे एमिति हेल्थ को नहीं कि एमिति गोटे हॉस्पिटल आसंदा जोटी कि गोटे छाता तले आमको सब सुविधा मिल पारंता सी भी अफोर्डेबल। बिल्कुल आउ से स्वप्न को सत करिथिला समस्तंगर प्रिय हॉस्पिटल आज भी 90 दशक रु आरंभ होइथिबा कलिंग हॉस्पिटल। बिल्कुल से गौरव को से आज नहीं चली एमती गोटे छात तले सर्जरी ठू नहीं ट्रीटमेंट पर्यंत डायग्नोसिस पर्यंत सबकि अवेलेबल होता एवं आज भी आम कहीपर केवल ओडिशा नुहे ओडिशा पाखे थिबा आम नेबरहुड स्टेट्स मानकर वेस्ट बेंगल हो छत्तीसगढ़ हो बिहार हो आंध्र प्रदेश हो सेठी मध्य कलिंग हॉस्पिटल का ना समस्त मुहरे। तेरे कलिंग हॉस्पिटल के जानी जे केते प्रकार एक्सपेरिमेंट करिछि सबुठु कष्ट कष्ट सर्जरी करिथबाटु नै आज पर्यंत लोकंक मुहरे हस फुटे एठु विदा करिसंती। सतरे ए कलिंग हॉस्पिटल आम ओडिशावासी मानक पई एक गौरवर कथा एवं ये जो हेल्थ सेक्टर कथा आमे कहूचे एठी मध्य खूब गोटे सुंदर कथा घटिछि जोठी कि आमे तांको कांग्रेचुलेट करबा एवं सबुठु बड़ कथा हला डॉक्टर सीताकांत दास यार मैनेजमेंट को टेक ओवर करछंती एवं गोटे खुशीर कथा कि तांको विजन मध्य क्लियर अछि ओडिशावासी मानक पई आम आखपाख सब स्टेट्स मानक पई निश्चित भाव जो गर्व जो नंबर 1 कथा रही कलिंग हॉस्पिटल से आग को मध्य रहइबो। आज तांको सहित कथा हवा जी कि विजन पूरा क्लियर रखिछंती ओडिशावासी मानक पई आम हेल्थ को नेकी नंबर 1 थिला आउ आग को नंबर 1 रखिबा पई डॉक्टर सीताकांत दास सर को। सर नमस्कार, वेलकम टू आवर शो। सर प्रथमे मेनी कांग्रेचुलेशंस आपन को विजन एक्चुअली क्लियर थिला आपन साइंटिस्ट यूएसए बेस्ड एवं सबुठु बड़ कथा हला किछि ना किछि एक्सपेरिमेंट करबा को आपन भलो पाती किंतु सर ताहले आपन काहे कि चूज करले हेल्थ सेक्टर को?
हेल्थ सेक्टर टा नुआ कथा मोपे नुए हेल्थ वेलनेस एंड वेलफेयर ए तीनटा एरिया रे मु काम करी आछि बहुत दिन धरी एंड एज यू सेड मु केवल जो कलिंग हॉस्पिटल कथा कहूनी मु सेक्टर कहीं कहली मु जितेबाला अमेरिका रही थी गोटे जिनस रिसर्च करा जाइथिला प्रोबायोटिक उपरे से प्रोबायोटिक रिसर्च करिकी आज जो प्रोबायोटिक नाटा शुणा जाउची सेटा को मु नंबर 1 करि परिची। आई हैव बीन द ड्राइविंग फोर्स फॉर द प्रोबायोटिक इंडस्ट्री।
निश्चय दर्शक बंधु मुझे आपन को जनवा चाहिए कि सर ग्लोबली रिकॉग्नाइज करंती साइंटिस्ट हिसाब रे विजनरी एंटरप्रेन्योर एंड ही इज द फाउंडर ऑफ यूएसए लैबोरेटरीज द लीडिंग प्रोबायोटिक कंपनी ऑफ वर्ल्ड चांसलर ऑफ जेके यूनिवर्सिटी कटक चेयरमैन एंड फाउंडर ऑफ डीडी इनोवेशंस। सर निश्चित भाव में आज आमर सौभाग्य कि आम आज बहुत किसी कथा आपन जानी पारिबु एवं जेमती मु कहली पुणी थे आपन को मेनी कांग्रेचुलेशंस आपण कलिंग हॉस्पिटल मैनेजमेंट को टेक ओवर कले। सर कहीं आपन चूज कले कलिंग हॉस्पिटल को?
गोटे कथा माने पडुची द वे यू सेड कलिंग हॉस्पिटल वाज number 1 corporate hospital in Odisha.
So first corporate
multi-specialty hospital thila. Ilage Kalinger Hospital not is the only one. There are many other hospitals are here in Bhubaneswar. They are also good hospital. To keep up our good name as the number 1, we are behind. Now we have to do some catch up. And so in my language we have to try to regain our reputation of as we will be number 1 again. In my life I am never number 2. I am always number 1 and this is not the experiment, this is a challenge for me. The Kalinger Hospital is a challenge for me. I will try under my management with the support of the team, support of others, we will regain that reputation. सेटा को करिया पे हेले if you want me, let me say what should be done. कलिंग हॉस्पिटल को जब देखा पर लास्ट 20 years भितर आमर जो जो अवस्था आमर इमेज थला से इमेजटा नहीं. Let us look to physical image. The building is old. Renovation is required. So for that reason, a first priority is mine. Let us do the work on the image. Image means start the renovation of the buildings which are not complete the building, so that will see it is done properly and looks like a modern hospital. It is not looking like a modern hospital anymore. So it will look. I have already started work. In fact, within last 2 days, I have been talking to the architect firm, those who did the work, and I authorized them start the work. ସେମାନେ ମୋତେ ଜବାବ ଦେଇଛନ୍ତି 6 ମାସ ଭିତରେ ଅନ୍ତତଃ ଯେଉଁ ନ୍ୟୁ ଟାୱାରଟା ହେଇଛି ସେଟାକୁ ସେମାନେ କମ୍ପ୍ଲିଟ୍ କରିବେ. କାହିଁକି ସେ ଟାୱାର ମାନେ କ'ଣ ସେଠି ହେଉଛି, ସେଠି ଆମର OPD ମୁଭ୍ କରିବ, ICU ସେଠିକି ମୁଭ୍ କରିବ. ତେଣୁ ଆମର ଏଲାକେ 250 ବେଡେଡ୍ ହସ୍ପିଟାଲ ଆମର ଏଲାକା ଅଛି. ସେଟା କମ୍ପ୍ଲିଟ୍ ହେଇଗଲେ ଆମର ସେଟା ହେଇଯିବ 300 ବେଡେଡ୍ ହସ୍ପିଟାଲ. Again with my new plan, again the new word I am using, it is not a common word, called extended stay in. ଅନେକ ଲୋକ ମେଦିନାପୁରରୁ ଆସୁଛନ୍ତି, କିଏ ବିହାରରୁ ଆସୁଛି, ଅନ୍ୟମାନେ ସବୁ ଆସୁଛନ୍ତି, ସେମାନେ ପ୍ରତ୍ୟେକ ସପ୍ତାହରେ ଏଠିକି ଆସିପାରିବେନି. ତେଣୁ ସେମାନେ ଚାହାନ୍ତି ଟିକେ ଅଧିକା ରହିବା ପାଇଁ. ଅନେକ ଲୋକ ଟିକେ ଅଧିକା ରହିବା ପାଇଁ ଚାହୁଁଛନ୍ତି. ସେମାନେ ତାଙ୍କର लो अटेंशन ताकू दरकार माने जो एक्सटेंडेड स्टे रे. तेणु सेटाको बेसी पैसा पड़बनी. तेणु दे कैन स्टे हियर. So that is also my priority, that we will have a extended stay units attached to our Kalinga hospital. Okay, then each and every department you said, again for last 20 years we have not done much upgrading. So we have to do upgrading of each and every unit, including our ICU. Okay, starting from the quality, or definitely to have a quality care, we have to have a quality care will be given by the experts, particularly in the field of healthcare. Many of the doctors, as you say, it was a training ground. After training, they have left. Many.
Yes, yes.
Many left. So my first priority is to bring them back and creating the environment which they will say, I am ready for the change, and I am ready for the change. If we cannot get back all the doctors, they are not the only ones, we can bring more doctors. Again, for your information, those who have gone, the top-notch doctors approached me, they are going to see me before I leave. During these last few years, whether you know or not, I have an exchange program with the University of Minnesota, so that what is happening beyond our Odisha, beyond our India, they are going to come and exchange. So that means we learn from other people, those who are expert in the field. So that is one thing I will be doing. So particularly I am in contact with the Mayo Clinic, the #1 clinic of the world. I am in touch with called University of Minnesota. They are the most reputable medical facility we have there. So these are the people I have in mind. They will come and time to time visit when you need. And then I will be having called exchange program. That means doctors from here, they can go and may spend a month or 2 or 3 at the expense of Kalinga Hospital. So we can say that part exchange program. We must be hearing called the Rockefeller scholarship, Fulbright scholarship. That kind of scholarship is available. I take this occasion myself is not only I am a professional, I am a philanthropist. And again, I do a lot of work I do under the banner of DD Innovation anyway, do under the banner of Dr. Das Foundation. So I am involved with, for example, if you like to see here in Bhubaneswar, in IIT, I have a innovation center, and to have next generation probiotic product and such other product. Again, extend the other side of the thing. I am involved, as you mentioned few minutes back, I am involved with JK University. JKU. JK University is a startup university, that is another called battleground or challenge place for me. So we are starting another 400 bedded hospital, and before that starts, and we have already completed called Health and Wellness Center. So it is already fully functional. I am very proud to announce it done, and we have already given ambulance and other services so they can reach out to some other villages so that they can come. Again, for your information, how I learn. We have a program from Smile Train. Anybody knows Smile Train? The Smile Train program, people those have a called clip surgery. Anybody can walk in, get a surgery, just go, not paying a penny. Who pays? Smile Train pays for that one. What I learned from that one, if Smile Train can pay for clip surgery, why not we have that program for cancer? Why should not have a program for our heart or such other serious illness for which people go out of Orissa, get the treatment?
These are expensive also.
Yes, very expensive. Here, the word called affordable. And again, as you very, very well know, like a Smile Train, things like this, I have been doing this kind of thing. I say this kind of thing I do. Again, for this, when it comes to student exchange program, these things I do. And I will apply my knowledge, my skill, my vision here for Kalinga Hospital. And Kalinga Hospital will not be shown as a Kalinga Hospital. It will be Kalinga Hospital and Medical Research Center. You must be hearing about COVID and other things. Where the report comes from? Call John Hopkins, Mayo Clinic, we get the report. They are hospitals. And this hospital is not giving that kind of report because we are not used to, we just only do the traditional healthcare do. So many other things, we had a discussion with our advisors, what are the things we are going to do. We can do everything at one time, we have to go to step by step. And in 6 months' time, I have a goal, before the end of the year, I will show them what they have seen. The place must be attractive to attract the good doctors. I made that decision within 2 days. I already made the decision, the architect firm will come and do the work. They promised me they will complete that AC tower within next 6 months. This 3 to 6 months time they can finish. So that means where people see the progress that we are doing. Like Sunday, so I am seeing quite a few doctors I have already seen. Sunday, one of the top-notch doctor who left our hospital, and he wanted to come back because he was not very happy. For last few months, 5 years, few things are going. I see they will have a better environment, better facility, better opportunity we'll have. So people are going to come back. The news, they are not going to listen to me anymore. I will be, because I am just taking over, you are taking me putting on the limelight. I like to see you will be putting limelight home. The doctors and doctors. Doctors attract the patients. Patients go, oh, this doctor is here, I will come. This doctor is here, I will come. So that environment we are creating and trying to get those kind of doctors back, those who have left, or if they can't come, then I will make sure that we are having some other skill and especially doctors we are going to have here. So these are my immediate plans we have.
Sir, any future visions you have? Kichi Kalinga Hospital ko niye ki kichi au kichi future visions na, these are only visions.
Before I answer, I should say, as I said, this morning I was talking to some people. There are some people, they are experts. They are experts. And they just knew what I have done, what I can do, they know. And they are doing here under our Odisha condition. They are the expert, I recognize them. So they will be recognized at a due time, due places, and they will be in advisory board. They will be serving in advisory board. Some of the people you have already seen, so they have come, no, they are not from Orissa, they have come from beyond Orissa. You have already seen them. And we will be seeing many of them, they will be coming and helping us to take it to our next higher level.
सर एक्चुअली कलिंग हॉस्पिटल जमती आम स्टार्टिंग कले ईच एंड एवरी पीपल को पई अफोर्डेबल थिला दो आमे वर्तमान किछि चेंजेस करबा बस फर्स्ट फोन चॉइस थिला कलिंग हॉस्पिटल सो आपन को टेक ओवर कर सारला परे एवरी पॉकेट को सुहाइला भला ट्रीटमेंट एक्स्ट्रा किछि हमर मशीन्स रहिबो कि से भला किछि हमें ट्रीटमेंट आमे पाई परिबो ओडिसावासी प्रत्येक लोक माने एठी आसी परिबे से भला किछि चिंता करछन्दी आगो को किछि प्लानिंग
Thank you. Your question is like a question for me. No, it is, that's what I was thinking. In America, if you like to see, it should be Affordable Care Act. Affordable. The word is called affordable, and health care is something. It should be not given only to the rich. It should be available to everybody. Just like I give the example, if through spinal train we can have a clip surgery. So we have to find who are those people, who are those companies they are going to help. Yes, if I can say I will, they will. So we will find, it can happen overnight, I'm sure we will find those people, they will come forward to help. Again, I'm not talking about JKU. If you hear that JKU story sometime, you'll be hearing how that happens. One word I am saying, philanthropy or charity is contagious. Philanthropy or charity is contagious. That means if I do, others will do. One of the best example, I will not sit here. It happened. I am so proud, so proud. They jump in. If Dr. Das can do it, we will do it. And that was spirit I saw here. So it is happening. It is not nothing new. It is happening. It will happen.
सर कलिंग हॉस्पिटल सब किछि रे आगरे अछि आमे कहि परिबा के हेल्थ केयर सेक्टर रे कलिंग हॉस्पिटल इज द पायनियर आमे किछि भी नुआ करिचे कलिंग हॉस्पिटल रे अदर हॉस्पिटल्स माने तार फुट स्टेप को फॉलो करछंती तो आपण आउ किछि नुआ एग्जांपल सेट करिया को चाहउछंती जेटा कि जेमति कहिले वर्तमान किछि गोटे नुआ चेंज करबार समय आसी जाइए तो सेमती किछि प्लानिंग अछि कि समथिंग कलिंग हॉस्पिटल रे आउ किछि नुआ एग्जांपल सेट करबो अलगा हॉस्पिटल्स मानको में
as I say Calling Hospital did in past. Calling Hospital is not doing at the present. Okay. That is one thing. Let me make it clear. We cannot say we are the pioneer now. We were pioneers. Yeah. So that the word I said, we have to regain our reputation as we are the pioneer. In order to do this way, in each and every area, we have to address each and every area. For example, like a heart, we never have one good heart surgeon. Are you not going to have one? Yes. Answer is yes. So these are the things I am giving an example to you. We will be. We are talking about cancer. Cancer. Can I start a cancer institute like a Tata Cancer Institute? No, it cannot be. But we can work out a plan in such a way we can do the work here, some basic work we are here, and have a collaboration with some of the institute like in India, and sometimes maybe in America we can have collaboration. I believe in collaboration, we will do collaboration. Anyway, then as I say, exchange program, the things we will have, and again, called continuing education credit. People take it, and doctors are required to take. If they don't know, do I know everything? No. They know by reading, by journals and things like this. In order to give that thing in person, we'll have an exchange program. Exchange program with a good institute like Mayo Clinic, Johns Hopkins, University of Minnesota, those things we are going to do. I have done this kind of thing so that they can appraise us what is new things are happening in the area. And again, telemedicine, you know, new thing. Lot of things are happening now. People will detect here, Dr. Das, do this, do this, do this. So this is something I am also going to meet our doctors, meet our managers. I will be doing that thing during my stay, and so I will be learning from them. So what are the things to be done immediately, particularly in healthcare sector, and the word called affordable healthcare. The word you wanted to hear that part, affordable, that is very dear to me. So that it should not be rich, by the rich, for the rich, of the rich. It should be for common people, by the common people, of the common people. So that is my goal. That's the goal I like to say. This is in short, I should say, like to get it done as soon as I can.
सर कौन रहिबो टेक होम मेसेज आम ओडिशा पीपल मानको पई एवं आम नेबर स्टेट मानको पई जो माने ऑलवेज बिलीव करंती कि कलिंग हॉस्पिटल इज द मेन गोल कि आमे एटिके जिबु क्योर हे कि आसीबु विथ अ स्माइल सो से समस्त पई आपन का टेक होम मेसेज कौन रहिबो
message again, as I mentioned to you, message is, I think what they're saying, to live up to their expectation, we have to do good work. Good work in the sense, good doctors, and definitely they will be the example for everything. And again, as I say, without good doctors, we cannot have the reputation. So bringing good doctors to Kalinga Hospital, the one who have left, those who have not also left, we are talking about bringing some other experienced doctors and specialists is the key that we are going to do. So we may open up some specialty centers like this we will do, but the basic thing is called house cleaning work. We have to do lot of homework we have to do before we jump into anything, and those things with their input only will proceed. And again, always, if you like to know, I am in touch with Mayo Clinic, and I am in touch with the University of Minnesota. I have been working with them closely, and for your information, some of the doctors from here, they have gone, taken internship there and working. Even now, I was talking to our friends here, like their children, I mean their daughter is there too. Why? They found there are some management school in Minneapolis, and which are called have a good name because of the quality of education. Same thing, I am in a place like Minneapolis, we have Mayo Clinic is our neighbor hospital, and University of Minnesota is our hospital. So they are my resource center for me to how we can upgrade our quality health care at a affordable price.
सर थैंक यू सो मच अपन को वैल्यूएबल टाइम एवं वैल्यूएबल विजन पाई होप अपन जोटा कहिले के थिला बट आमे एबे भी कहिबु लोक मान को भीतर अछि एंड अपन को जा विजन अछि से नंबर 1 आहुरी हे जाओ इन फ्यूचर वी होप फॉर द बेस्ट एंड अगेन वेलकम टू आवर ओडिशा सर थैंक यू सो मच फॉर योर वैल्यूएबल टाइम
थैंक यू
बिल्कुल नंबर 1 हबा भरोसा जितिबा बहुत सहज हेताय किंतु वर्ष वर्ष धरि ताको कंटिन्यू करबा बहुत कष्टकर काम कलिंग हॉस्पिटल सेटा करिछि निश्चित भाव में जेतेबेले सम एक्सपीरियंस्ड एवं बहुत भल मनीष किसी जिनस को टेक ओवर करती तांको विजन ही किछि हाई थाए एवं एटा आम ओडिशावासी एवं आम आख पाखरे थिबा नेबरहुड स्टेट्स मानको पई गोटे गुड न्यूज के आम हेल्थ सेक्टर को आमे जेते अपग्रेड करबा आम लाइफस्टाइल आम हेल्थ आम वेलनेस आहुरी भल हबो सेथिपाई आमे सब बेले कहू पॉजिटिव थिंकिंग आपन को सब बेले आउट के ऊपर को नै जिवो दैट्स व्हाई आपन को हेल्थ को बहुत भल भाबरे केयर नियंतु एवं आपन को हेल्थ को केयर नबा पई ऑलवेज अच्छी कलिंग हॉस्पिटल आउ आपनकर हेल्थ रिलेटेड वीडियो पाई ऑलवेज फॉलो करंतु प्रिकॉशन फॉर हेल्थ को आपण हमको फेसबुक इंस्टाग्राम एवं ट्विटर माध्यम रे मधे फॉलो कर पारिबे सुस्थ रहंतु खुशी रे रहंतु नमस्कार समस्त प्रकार रोगर सफल चिकित्सा पाई जोगाजोग करंतु ओडिशार निजस्व हॉस्पिटल कलिंग हॉस्पिटल।